Welcome back to Let's Get the Neighbors Talking. I'm Courtney.
I'm Lauren.
We are from Moon and Stone, and we're here to talk about something not weird. We keep saying we're talking about weird things, but then topics come up, and I'm like, this is not weird.
No,
this is awesome.
This is must-need info.
It is, especially for our age group.
Yes.
We are here with Dr. Ashley Amalfi. Welcome, Ashley.
Hi, guys. Thank you so much for having me.
Thank you so much for joining us. So Dr. Ashley Amalfi is a board-certified plastic surgeon specializing in cosmetic surgery of the breast and body. As a mama herself, she's especially passionate about helping other moms feel confident again through procedures like mommy makeovers. She's known for her expertise in breast asymmetry, revision surgeries, and is the only female plastic surgeon in the Rochester area offering labiaplasty.
Yay!
We have a lot of questions about that.
We do. Its own podcast. It could.
Right? Yeah. So Ashley has been featured in major outlets like Vogue, the New York Times, NBC, Pop Sugar, and Newsweek. And when she's not in the OR, she is popping her family and all their amazing things on Instagram, sharing her life as a surgeon, wife, mama, preteens, fashion lover, yogi, puppy wrangler, and pretty much, I mean, this is another question we have. How? But we've actually said before, like in like just conversations around, like when we like watch all the awesome that you do, we're like, she must not require as much sleep as we do, or something.
I
Or
sleep
downtime.
a good amount, I would say.
Okay.
But like when I get up, I like go, and there is no downtime. There is multitasking of literally everything. There's a lot of caffeine.
Okay.
And then
I like
literally I put my head on the pillow and my husband says he's never seen a human fall asleep quicker in his life. I literally in 30 seconds I'm out. I sleep like a rock and then I just cycle.
And then you're like an Energizer bunny the rest of the day.
Yeah, it's like hypomania. I just like operate at this like super high level and then I turn off and then I turn on again.
But it seems like you build in plenty of time for your self-care.
Yeah, I do. I mean, and that's exactly what I do. I build it in. Like I wake up early, but I wake up early so that I can have an hour to myself to work out. And
Yeah.
and then on days where I have like more administrative time, I'm making sure to like do things to take care of myself and energize. And sometimes like in the chaos of it all, it feels a little bit selfish, but I know it's really important because like that's my fuel. The self-care and even like the time with friends. Like it's really important and it's really, I feel like so hard at this age, but I really, really try to squeeze it all in.
You do a great job at that. I am always impressed that, like Lauren said, you make time for yourself. You make time for your kids. And I mean, it must be like a new world being a surgeon in the age of social media because you created a brand for yourself.
Yeah.
As you've created your surgical, I guess, career, which it's just so interesting to see that you share so much about yourself with all of these people, but you're also posting, post-surgery pictures, but you're posting about your kids. Like, how do you find that balance? And where, like, you are like a pioneer in that, I feel like. And
Yeah.
you see a lot of people doing it now, but definitely I saw you doing it first, like combining that work/home life with your brand.
I mean, I think that's most authentically me. And so like I see some people who like exclude one part of their life and they're only showing this facet of it, but like all of it is like honestly and truly me. And so I think the way I meld it together is very real. And I think that's why it resonates with people because they're like, oh, wow, like this is actually her life. She's doing this with her friends and then she's at the gym and then she's in the OR making breasts and then she's at diving practice and then, she's at a school function. But like that really is my life. And I think for a lot of people, it makes them realize I'm kind of just like them. My job's just like a little bit weird, which I guess goes with the podcast, right?
Yeah.
I think it's relatable and it's very honest. And I think people, when they think about surgeons and, just their bodies and they're self-conscious about that that whole experience is up here on an anxiety level. And then when they get to know me beforehand and they're like, wow, she's just like me. She's, at practices all weekend and going on spring break, and she's just doing a different job in the daytime. And so I think it makes me relatable, and it gives people a chance to sort of de-escalate all the anxiety they have about plastic surgery and feel super comfortable before they even really meet me.
I mean, and what an amazing strategic move on your part as a badass career woman.
Yeah.
Because you started building this before you moved over to Coachella.
Yes.
And so you built your own following, your own, so that when you did move surgical places and you moved up in your career, like you brought that with you. Like that is a very business minded, just like Lauren is, very business minded, like girl boss focus is to like, hey, I'm just not an employee of this organization. Like I am building this brand and I am bringing this with me and I have a lot more to offer. Like that's fucking really cool.
It was very intentional at that point because like I knew what I wanted to build and what I wanted to grow. And I knew I had to branch out a little bit from like the restraints that I had at the university, but I did it, I think, in a graceful way and sort of really worked things out like legally as to how I could do that. So I think I did it the right way. But I also didn't take no for an answer. I didn't take like, well, no one else here does that, so you can't do that. I was, always asking, well, how can I do this? That doesn't, sort of push the wrong buttons, but helps me build, and grow.
Yeah. And being authentic, like you said before, I think that is very important. All of it may have been done intentionally for business building reasons, but it is you. You show up as who you are. And I agree. People love seeing that and what a comfort it is to go into a consultation with you or an operating room, knowing that like you've gotten to know that surgeon a little bit more. And that, especially with women in surgery.
Totally. I'm curious to know how you got into plastic surgery. Were you, I'm assuming you always wanted to be a doctor. Was it always plastics? Because my middle actually wants to be a plastic surgeon.
Oh, I love this.
Yeah.
I think I just had really early exposure to it. I wanted to be a physician since I was probably about 9 or 10, my mom will tell me, but we didn't have doctors in the family or nurses or anything really. And so my parents would just kind of hook me up with family friends and connections and be like, here's Ashley, she wants to be a doctor. Can she like come visit or whatever? Because they didn't know what to do. And so I used to shadow doctors when I was like as young as in high school. And I do it like on the weekends or over summer break. And it just so happened that some of the early people that I was exposed to were plastic surgeons. So the first plastic surgery I saw was more of like the pediatric side of things, craniofacial surgery. And so I think I went in kind of thinking I really wanted to do that. But I realized I just really wanted to have my own kids. I didn't necessarily want to operate on them. And then as I was in my training, I really just fell in love with female patients. I think I can relate really well to women and sort of help them not feel self-conscious and sort of feel empowered to make those decisions. And I just found that those relationships that I built with the female patients were the strongest and, again, the most authentic. And so I just sort of felt pulled in that direction. I mean, I remember shadowing a surgeon here who did a bunch of breast surgery at the university, and I was young, like probably in college, and he did all breast, and I would spend like the summers in his operating room, and I was like, who would spend their whole career making boobs? And then I did, but so I really didn't think like the idea of breast surgery was like, this big moral calling. But it was more of the patients that, and the transformations that I found to be really profound. And honestly, I started my career doing all breast reconstruction when I was at the university. That's sort of how I built. And I thought that was so incredibly rewarding. And I was a little bit worried to transition over to Coachella and like really go down the cosmetic route because I thought I wouldn't have the same fulfillment and I wouldn't be changing people's lives in the same way But like what's so remarkable is it's the same. It's the same transformation, whether you're, dealing with cancer and restoring your body, or you shared your body with your babies and you're bringing yourself back to a state of confidence. And so I find plastic surgery in the aesthetic space to be honestly just as rewarding, which is cool because that is what fills my cup.
I love what you said about working with women, because it was one of the questions that kept coming up for me. Is you are a very strong feminist and you support women and you love working with women, and like there is this conflict, I would say, in some respects, for people when they want to support, like, be your body, be yourself, like I love you as a woman, and then supporting them to change what their makeup is. How do you balance, I guess, supporting women and appreciating them for who they are, and love your body, all of these things? I know you're a big yoga person, like all of those, accepting your body for women, but then also accepting that some people really truly need that change in order to feel that self-love. And like, it's just, there's a dichotomy there that I think, for a woman, a female surgeon who is a feminist and a yogi and all of those things, it must be, you must kind of walk that line.
It is. And I think you have to sort of talk patients through both. There are some things about our body that, we can thank our mom and dad for, and they are the way that they are. And genetically, there's, large and small versions of everything out there. And once you start seeing bodies, we're all just really patterns, and it's all very genetic. And so there's a little bit of education to patients that, you do have to sort of love some of these parts of your body because we can't dramatically change it. But then the flip side of that is, but we can make you the best version of the body that God gave you, and a better version, in one that you feel more confident in your own skin. And then you have to help women understand that they're worthy of that change, because all of the patients have mom guilt, all of them. They're all like, well, is this selfish? It's a lot of money. Is it dangerous? Like, how do I make a big decision? But I think you have to really empower women. And I even tell my moms, like, tell your girls, don't like tell your girls you got a hernia repair, like tell your girls that this is okay, that, mommy did this and I made these beautiful babies, but, my muscles are damaged and I work out and I do everything right. And there are some things that physiologically we can't change after pregnancy. There are hormonal and anatomical changes that you can't fix at the gym or with a diet or with Ozempic. And it's okay to fix them. Just like we don't really shame our kids when they want braces because their teeth are crooked.
That's a great analogy.
You can make the best version of the teeth you have. Now, your front teeth might be big, or you might have, a small jaw, or whatever that is genetically, and we can't necessarily change that, but can we make your teeth the best version of what you got? And should we feel bad about that? No. We want to give that to our kids, and so we should want that for ourselves.
I love that.
Damn, girl.
That is great.
I have this talk every day, you guys.
I bet.
Yeah. And I mean, and having a young girl yourself, you probably are having to explain that sort of, that balance and that sort of, I love you the way you are. And yes, I help people love themselves to be their best self and to feel confident in their own skin. And I'll never forget, I ran up to Ashley at Sue's at the hairdresser and I lifted my shirt up.
You did?
Yes.
Okay, so one of my questions was going to be the craziest unsolicited advice you've ever had to give, and it seems like it might have been Courtney.
Yeah. I was like, hey, we like chatted.
Your stomach?
Yeah, because of my stomach. Because I was like I was insecure with my stomach after I had 3 big babies.
Yeah.
You're big.
And I was
huge.
Like, can I just, she's like, she has no problem. She's like, let's take a look.
Yeah.
And she was like, yeah, we can do a mini on you, no problem.
So do you do tummies as well, or do you just specifically do, you do whole thing?
Yeah, I do a lot of breast and I do a lot of tummies.
Do you do necks?
I don't do necks. I used to. I used to do some of the facial stuff when I was at U of R, but then I really kind of specialized in what I really love.
Yeah.
So what do you specialize in? Let's talk about that.
So I do all cosmetic surgery and essentially from the neck down. So most of my practice is mommy makeovers. Mommy makeovers usually mean like a breast surgery and a tummy tuck and like some more specialized liposuction or, whatever it is that you need. And those are all very specific again because everyone's bodies are genetically so different. And so that is the majority of my practice. But I do a lot of, you know, more advanced breast surgery where people have had multiple surgeries that have maybe sometimes gone wrong. A lot of times those are the patients who are traveling in to see me, or,
Yeah.
young women who are born and have, cosmetic and congenital differences of their breasts. And those are really rewarding cases to do. And then I have weight loss patients. So with weight loss patients, they have like extra skin on their arms and their thighs, their backs. Those are less common, but we do all of those. And then the big thing that I brought to Quotella that they hadn't done before is labiaplasty. And that just like ties in so well with these like awesome moms and women that I take care of who have this problem that is like so uncomfortable or they're so self-conscious about, and they've never really felt comfortable to talk about it before. And it's such a simple, easy little procedure that makes women feel so instantly great and secure that it's a really cool thing to be able to, do in the community.
We don't even
Lots
know
of
any.
questions.
Yeah,
We had like a 10-minute conversation at the Kane Brown concert last night
Yeah.
about labiaplasty. Some people also had some suggestions.
We're okay. We're not even sure what it is and how
Or why.
or do you like do we need one? Like do you
Yes.
know if you need one?
It's like a breast reduction. I always say like if people are like some people are like, why would you ever get a breast reduction? Well, it's probably because you don't have big breasts. So, it doesn't really bother you. And so labiaplasty is really talking about the labia minora, the inner lips. And in some people, they just are really big.
The inner ones, not
Yes.
the outer ones.
Not the outer
Okay.
ones. It's usually the inner ones. And in some people, they're really long, or sometimes one side is really long. I mean, they're like breasts. They're like a secondary sex organ, and they can develop in all different shapes and sizes. And then sometimes women carry like really big babies. And when you get like really swollen and stuff because you have all those venous problems when you have big pregnancies, sometimes that can make just like the whole labia area swell. And then the skin gets stretched out and kind of hangs. And so for these people, they're usually like super fit, super healthy runners or cyclers or like yogis. And all that extra tissue down there is just super uncomfortable. It gets rashy. Some people get sores. They have to like manipulate things to wear certain clothing or to ride a bike or to have sex. And so it can be physically pretty uncomfortable.
Yeah.
That is not anything we knew.
Yes.
Right?
No.
That didn't come
Right.
up.
But it makes sense because do you remember I would always say that when or maybe this was just me, but when I was pregnant, it felt like on my vag that there was like a brick hanging.
Yes.
Yes.
That
you
like
did
you
say
know what
that.
I mean? Like that it was
The-
just like, oh my
the
gosh.
blood-
You
Yeah,
had all those
green.
veins.
Yeah,
Yes.
I had all the veins too. I
Yeah.
mean, maybe I do need this. I'm not really sure.
I mean, the people who need it, like, well, no one
You
really
know.
needs it. Like, everything is a variation of normal, but the people who really seek it out are honestly really uncomfortable. Like, it's affecting their life in some way. It's very few and far between that the only reason they're there is that they don't like the way it looks.
Okay. Yeah, that
it's-
makes sense.
It's usually pretty symptomatic, and if you see the photos, they're usually not subtle.
Got it. And when they come in, like that's gotta be uncomfortable to talk
But
about.
that's why
Like,
that's why
embarrassing.
Dr. Ashley is the best.
I
Because
know.
you talk to her for like 5 seconds and you're like, "Oh yeah, no, everything's fine.
Correct.
It's just like my teeth."
You got to normalize it.
Braces
Like,
for my
you
vag.
know,
Yeah.
one of the first things we tell them is like, I really do 1 or 2 a week. So think about that. Like in the Rochester
Wow.
community, there is that many women who are like sort of suffering in silence and dealing with this and being embarrassed with their partner or, reluctant to tell their mom. And if you normalize it, it really helps them just sort of calm down.
Hmm.
And then we have a long discussion about honestly how easy the procedure and the recovery is. And then, that helps them calm down a little bit more. And then the very last thing I do is actually examine them. And what I found to be really helpful in those patients is we use a marker and I give them a hand mirror, and some of them are like, I don't want to see it. But I'm like, no, let's like look at it together. And then I take like a surgical marker and I'm like, see all this skin that like hangs? This is what we'll trim away. And then they're like, okay, let's do it. Yeah, I'm ready. When can we do it? And it just helps them sort of visualize what it is too, because they all know that they're uncomfortable, but also like as women, it's not like we're seeing our friends' labias,
Yeah.
we're seeing
No,
probably a
we're
lot more
not.
boobs than we're seeing of that. So sometimes people don't know like what a realistic expectation looks like.
Right.
So
And this isn't something that is covered under insurance, even though it's uncomfortable, right?
no,
Or,
I mean, no, not at all. Even, yeah,
yeah.
similar to even like a small breast reduction, insurance doesn't cover it unless there's this huge literal weight that's coming off. They unfortunately don't consider those things medically necessary.
Yeah. That's a bummer. That seems medically necessary.
I
Well,
know.
especially reduction. Like,
Yeah.
Yeah.
I mean,
Yeah.
I can't even imagine.
Carrying that weight.
No, so my one of my good friends from college, she had massive boobs and had a reduction. Like I couldn't, like she had divots
Yeah.
from bras in her shoulders. I know.
Yeah.
Yeah.
Insurance is getting really tricky with that stuff. I mean, 10, 15 years ago when I started training, they approved so much, even in congenital breasts. Like if one of our girls developed and only developed one breast, it's not covered.
That's crazy.
It's crazy. It used to be, but we're sort of moving away from that because insurance doesn't consider the breast a functional organ, right? Tell that to our
They
children.
hate women.
Yeah, tell it to our kids
They
who
do.
survived on breast milk, but um it's sort of a tough situation to be in. But like thankfully people are comfortable telling their moms and even telling their dads that it bothers them, and we see these girls in super supportive families and it really changes
Yeah,
their life.
absolutely. So when you're doing mommy makeovers, I'm like fascinated by this.
Yeah.
You are taking you take it as a whole, right?
Yeah.
So you're not, somebody's not like, oh, I just need boobs or I just need a stomach. You're really looking at the person as a whole and how
Yeah.
can we balance and like nip here, snatch
Yes.
here, give a little
Oh, so
extra here.
it's like a one and done session with you?
Oftentimes, and
That's amazing.
that's like kind of a hard thing. That's something that like I had to learn along the way because it's like as a woman, I don't want to tell you like, your ears stick out and then like you never knew your ears stuck out and then all of a sudden you're self-conscious about something. So I think it was like a delicate thing that I had to learn as a surgeon, how to tell people like, hey, does this bother you? Because we could do this and then it could make your outcome even better. Because, what I had to realize is they're there for my expert advice. I'm not judging anyone. I'm not telling anyone they have to do it. But if they want the best result, I have to share my knowledge to tell people, well, if we did these things together, then this is how it would look. And I think this would be the best result. And I realized that that's really what people want to hear. They don't
They
just
do.
want to look up a procedure on the internet and then find a doctor and have it be very transactional. They want it to be very personalized. And so I think I've learned how to do that in a delicate way that helps people get really insanely good results, but not feeling like overdone or like they look different, but like just that they look like the best version of themselves.
Right. And when you have that, when you become a mom, like your body ceases to be yours for
Yes.
so long that there is this feeling as you get definitely into the 40s and 50s where you want to reclaim that. And
Yeah.
like, I want to be back in my skin. And that goes with, working out, exercise, yoga, meditation, even sexually. Like I think women just want to take that back and there's
Yes.
hormone replacement therapies that are helpful for that. But I do think that I support women who are going to see you or other surgeons because they want to reclaim their
Yes.
body.
Yes.
And it doesn't mean that like you want nobody to ever notice. Like I read something, I think in one of the articles that
when
my
she
tools-
starts pointing, it's something's coming.
you said about breast augmentation looking natural. Like I want natural breasts.
Yeah.
And you were like, no, you don't.
Yeah.
You know what I mean? I mean, no, you don't.
Yes.
You don't want them to look natural because that's why you're here,
Yeah. Yeah.
right?
Yeah. But I think sometimes it's hard to speak the same language as patients too, you know, because sometimes people say they want natural, and then I'm like, well, do you have a photo on your phone? And then like, it is not natural what they pull up, you know? But like sometimes it really is. And so I think speaking the same language and having that Instagram that they're looking and snapping pictures of what they like and even just as much what they don't like is really helpful for me so that we can kind of get them to their dream result. And then that transformation is really profound. Like you see women's whole demeanors change, their confidence, the way they dress changes, that eye contact they make changes from that first consult where they're so uncomfortable to what they look like when everything is all healed and it's behind them. It's a pretty remarkable journey. And it's just really, it's fulfilling to me to just see that every single day, to see those people literally transform their lives. I usually tell moms, like, think about what a bad day you have if like you have a bad hair day. Like my hair is like sticking up here and it's driving me insane, right? But like literally as women, you probably haven't noticed this little baby hair, but it is ruining my day, right? Like we perseverate on the dumbest shit. And like
Yeah.
imagine these women who put their clothes on every day and they tuck their skin into their jeans and they buy special jeans and they have to wear these expensive, hideous looking bras just to get their boobs back where they want them. Like so much effort goes into like how unsatisfied they are with their body. And then that affects how they show up, you know, like you said, sexually with their partner or the confidence and comfort they have when they are with their kids. And I see all of that transform when they just feel good, when you don't have to worry about putting your jeans on, you just put your clothes on and that's it. You're just putting your clothes on and you feel awesome and you show up for your day in such a different way when you feel good about yourself. And so that's the part that I try to explain to moms who are super hesitant about doing something, but then they always see it on the other side because they all feel it.
That sort of confidence that you're giving people is unbelievable. I see it in your Instagram. We love following.
Yeah.
But what I always find fascinating is the people that are taking pictures of themselves in post and tagging you and saying like, thank you for this.
Yeah.
Because I feel like I want more women to be like, yeah, I got this done. I got this done. Like
That's what she was talking about, normalizing it.
I want to like, let's have a conversation about it or be proud of it. Like, don't be ashamed of it because that just causes the craziness of women to like perpetuate.
But that just is, that's like over time, right? So like the more that things get normalized, the more people feel comfortable about sharing because they're not afraid of judgment or shame or all of that. So it just is like a slow, steady thing. But I do think that it is happening more.
Yeah.
Like even just all the talk about women getting older and perimenopause and all the things that are happening as, you know, we gracefully age.
Yeah. It's generational. Like as millennials are becoming perimenopausal, millennials are more comfortable sharing. But then like if you look at Gen Z, like these kids have no shame in it at all. I mean, my 9-year-old has like a face routine that trumps mine, you know? So, and that's like self-care. Like, I know like we want to make sure they're not using unsafe products and stuff, but like also like her skin's freaking amazing, you know? And she actually like gives a shit, you know? So as this generation who's like so beauty conscious and self-fulfilling in the things that they do and how they choose to spend their time and what they're looking at. I think this generation is going to be very open about self-care because they already are, you know, it's just their whole world. They don't even think of it as like taboo or self-care or, you know, beauty secrets. It's just their way of life. And so I see my younger patients being much more comfortable sharing, but I think that kind of trickles over into some of the menopause makeovers too. And then also I find a lot of people, I mean, I'm shocked at how many people say yes to have their photos on social. I mean, I have, twice as many who say no, but the ones that do usually will say like, I never thought I would say yes to this, but it was so helpful for me to see bodies that looked like me and see realistic results that I want to do that for someone else. And that's what it's really about. And that's how you pay it forward. And that's how we are seeing that shift, which is slow, but it's definitely there to people just really owning what they do.
What does a menopause makeover look like compared to like a mommy makeover?
Yeah.
And when you fall somewhere in the middle,
Yeah,
how does that?
I mean, I think there's kind of like two groups of people. Like there's people who have kids and they don't even recognize themselves. Their bellies are totally different. Their muscles are just blown apart and they feel and look pregnant, even though they're not. And so I think there's some people who have some urgency to have a mommy makeover because the changes from their pregnancy or multiple C-sections are profound and they just can't, not do it right away. And then I think there's a group of people, sometimes people who avoid C-sections and have natural childbirth and are super fit and health conscious who are able to sort of maintain their body even after kids, like they get back to their weight and then they have a pretty healthy lifestyle. And then
you hit an age bomb.
And then
you hit an age bomb.
Yeah. Yeah. And then perimenopause hits and they're like, shit, like I was doing everything right for the last 45 years and I was like maintaining this and then like I can't anymore. And you can't because of hormones. And the hormones cause you to gain weight and for your body shape to change and your metabolism to change in ways that you don't know how to control anymore. And so just like in general, patients will gain like weight in their bra fat, their breasts will sometimes be like a little bit larger with hormone changes. Their skin starts to get a little bit looser and a little less, tight rubber bandy as their collagen changes. And so the needs are a little different.
Necks,
so
a lot of necks.
They need a little bit more liposuction with their tummy tucks because there's these little hormonal pockets along the mammary line because we're mammals. And so we get little pockets of fat like under our breasts that are hormone mediated and you never had before. Yeah. Do you know what I
it's
call
like my
them?
ribs. It's like my ribs stick out. Like they don't look like they're where they're supposed to be anymore.
Yes.
Not good.
I call them chicken nuggets because I don't know what else to call them. But I call them chicken nuggets because you get like these two little chicken nuggets under here and they're little hormone pockets of fat. So there's all these little nuances that menopause sort of brings to us. And then the skin reacts differently too, because you don't want to just go do liposuction because then your collagen's kind of getting crappy. And so if you just did liposuction, then we'd all sag, like a puppy. And so then we have to treat the skin with sort of tightening devices and different lasers and techniques so that we can kind of tighten the body too. And so it's a mommy makeover, but it's just, again, that very personalized, tailored focus so that it's addressing some of those menopause issues that a 30-year-old mom might not have.
Right. Like there's no, I call myself Spongebob Squarepants now.
Yes.
Like I don't have a waist anymore.
And that's hormonal.
She's like, I am now square.
I have square. I've never, ever had this body before. It's like somebody just gave me a new one.
It still makes me laugh every time.
I call it that too, because I take all these pictures of the front because everyone's worried about the front, but then I make people take a picture of their back because we don't see ourselves from behind, but it affects like our clothes and our silhouette. And so I take a picture behind and we get SpongeBob butts.
Yes.
Because we get this like hormonal fat here, which literally we get to protect our spinal cord when we're pregnant and to balance the belly. So it's a physiologic change that is actually supportive of the baby, but it doesn't go away.
That's why your butt goes up your back.
Yes. Yes.
Oh,
our spinal cords are very protected. Our vertebrae are very protected. And we're
The
supposed
body
to,
is amazing.
it's
Like, that's
wild.
amazing.
It's
You know what I
wild.
mean?
Yes.
But like once
Like,
you start understanding these things, then you're like, yeah, no, duh, I can't go to yoga and get rid of that. Like it is a physiologic hormonal change in my body. But like once you explain that to people, they don't feel like as pressured to like be perfect because they're like they can be okay with doing their best and then understanding what is a little bit outside their control.
What do you think the reasoning is for your body or protection of your body that we do gain this weight in our 50s and late 40s? Like,
It's
what is this middle weight for?
well, it's really because
fun.
we don't really need fertile bodies anymore. And honestly, evolutionary women are really just here to reproduce. And so once our bodies are done reproducing, they sort of lose their functional purpose, which is terrible, right? Because we live longer than men now. But
I do
that,
not like this.
right? But like, actually,
Lauren's face is like
it's
shocked,
terrible.
but okay, continue because I'm very interested in this.
I
I'm
mean, but
sad.
like it from an evolutionary perspective, like we already hit our prime, guys. Like we did our thing.
Not
That's
true.
yeah. I know it's terrible. But that's why our bodies
No.
sort of stop being as functional because, the hormone change and then, in evolutionary times that there was nothing really else for us to do in from a biologic perspective. But
It
here
just
we
it
are.
gives up.
I
It
know.
gives up.
But we don't give up anymore, so we got to get our bodies
No.
back. Yeah.
No way. No way. And actually, in so many ways, I've always been like very interested in what Ashley does, and I'll probably be seeing her sometime soon. But I also am very much more in my body at this age,
Yes.
which is weird. Like I am more confident. I actually
Yes.
am more confident in who I am with these hormonal changes.
Yes.
However, you also feel like you're in a stranger's body. So it's just kind of, it's trying to figure out like, this is who I am. And I'm actually more confident about who I am at this age, but also I don't really know what's going on like between my neck and my vagina.
I'm sorry. I don't have any words left.
I'm sorry. Just
But I love that you take the woman as a whole. Like, I think that is so important to take in their mental capacity for change, their confidence, and how to build that and how to do it all at once. Like, I love that you're taking the body as a whole, just as you would like trying to like any artistic thing you do. Like,
Well,
you
I
don't
mean,
just fix one thing.
you don't just get a new couch. You need a couch and a coffee table, and then the rug doesn't match. And then, if the floor is crooked, well, we got to start from the bottom and build up.
It's like the book. If you give a mouse a cookie, right? And then remember that book? And then he gets something else, and that else, and
Yes,
that else, and that
exactly.
else.
What I am curious before we
I want to
wrap it up.
You're not.
You just said I have no words.
Well,
I know. I
that is true. Yeah, I did. My
evolutionary
mind got
science.
blown for a few minutes, and
I'm
then
sorry.
now I'm back. But I do want to know the funniest, other than Courtney lifting up her shirt at a hair salon. What is a funny or best unsolicited advice? Because I mean, I'm sure. Does that happen all the time? Like you get like
It
you're like
does.
running text. Yeah.
But like none of them are really unsolicited. It's really just continuous all the time, anywhere and
Yeah.
everywhere I am.
Yeah.
Whether I'm at like a kid's doctor's appointment or, a sporting event or a party or
People are just lifting up their shirts.
all the time. All the time. All the time.
But good news for your husband, maybe?
I know. I think my whole family is very like they're very they're very used to seeing boobs everywhere. So, I think they're very immune to nudity at this point.
Yeah, I bet. I bet.
I think doctors have that wonderful ability, though, to give advice no matter what,
Yeah.
kindly. Like, I have friends who are doctors, and I'm like, I must be so annoying. And then we have another friend who's super annoying. I know she has your cell phone number, and I'm really sorry about that. But she'll text anybody anything
Well,
immediately.
that's
a
because
doctor.
they're nice. It doesn't mean that they like to do it.
I know. That's what I mean. They're so nice with their
That's who
knowledge.
we are. I mean, we just
Yeah.
like give advice in all aspects of our life, whether it's medical or not. Like, I think we maybe are just like those caretaker kind of people, and we're that friend and we're that family member.
Yeah.
We're that
Would you
parent.
say in general that's your
Yeah,
energy vibe? Like
yeah,
you're the caretaker.
yeah. I think I'm
Yeah.
like the go-to. I think there's
Yeah.
probably 50 people who, if you asked who would be your first phone call,
Yeah, it's you.
yeah,
Yeah. That's really
cute.
sweet.
It's cute.
Probably exhausting, but
I'm
really
just about
sweet.
to say, who
People
fills you up, Ashley?
People fill me up. I don't know.
Good.
I think those relations, I mean, I just have so many people I love in my life. Like so many people, my family and my kids, but like so many friends. I kind of collect friends, like people collect things, but like I just have people from all different parts of my life who are so vastly different from each other, but I love and I look to for very different things that fill me up too. So,
I
Mhm.
I love that you put such a importance on relationships because like real I mean that is ultimately what ends up filling people up
yes.
is like the connection and your relationships and what you're gaining from all that. Damn, girl, you know what? This was amazing.
Yeah. I mean, you were one of our favorite people to start. Now
And
we're obsessed.
and we were like, we might have to pay her after this for a consultation because she doesn't. But actually, we veered away from ourselves quite a bit. I'm proud of us.
We did. I mean, I could go on a deep dive.
Yeah,
Yeah,
she,
we
Courtney's.
can do
Yeah,
that off camera. It's okay.
Exactly. Exactly. No, I think it's been a wonderful experience to be able to hear from you and how you support women and seeing female doctors out there doing good things for other females is
empowering.
empowering.
Yeah.
Exactly. It's wonderful to have your support there. We're going to do a little
This or that to get to know
Okay.
you.
this or that.
Okay,
Okay.
are you ready?
Yeah, I can't wait.
Okay.
Okay.
You going to do them all or you want me to switch on and off?
I don't know, Courtney. Let's just see how this goes. Okay.
You can hog this.
Maybe I do. Okay. We know you like to cook. Scalpula or spatula?
Scapula. Oh, no,
Okay,
scapula
okay.
is a bone. You mean scalpel?
Scalpel? Yes.
Scalpel. I mean, I just said
What did I say? Scalpula?
Scapula.
That's a shoulder.
Is that your leg?
Bone. That's a bone back here.
Oh man, I missed that
Scalpel.
day in medical school. I missed it.
That's okay.
Scalpel. Okay. All right. Go, Courtney.
Operating room playlist. Beyonce or Beethoven?
Oh, Beyonce.
Beyonce. Okay.
I
Yeah.
kind of knew the answer to that.
Yeah. That was the right answer. But maybe she likes a little zen.
Maybe.
Okay. Fashion Week front row or the PTA bake sale?
Oh, Fashion Week front row.
Okay. Yeah.
Agreed.
Yeah.
You
Okay.
see, this is our girl.
Yeah.
Yeah.
Totally. 100%.
She's buying cookies at Wegmans just like we are.
Yeah. Well, I don't know. She's a good cook.
She
You watch
is
her
good,
Yeah.
cook, but she knows how to prioritize.
Yes, and my guess is that she knows where to cut corners. Like,
Yes.
yeah, I don't have to bake the cookies. I shall buy them because they're still delicious.
Yes.
Savoyas?
Yeah.
Yes.
Okay. All right.
Yeah.
I like that she's agreeing.
We
Okay.
just told her what to do and it would be.
Okay, go.
Okay. Botox appointment or book club night? What's your ideal self-care?
Honestly,
Maybe she doesn't get Botox.
yeah, I would say book club because I just do
She's
Botox when I have a cancellation in the middle of the day. So I don't even need to pencil that one in. So book
Nice.
club.
Oh,
You're
yeah,
very
because
lucky.
you're already there.
I
Yeah.
mean, yeah, I'm just there and, if
Yeah.
I got 5 minutes, then the girls find
Can
me
you
in
do
the
it
middle.
yourself?
I was going to say, can you
I
do that yourself?
I do. Yeah. I don't think a lot
Wow.
of people do, but I'm, just sort of that level of crazy. Yeah.
Yeah,
Okay.
you're that
Same.
badass.
Don't ever give me a
I
needle.
mean,
Yeah.
like recently, like a year ago, we had a cancellation, and so me and all the girls, we like pierced our second holes in our ears. I was like, guys, should we pierce our
Oh.
ears?
So fun. She must have the most fun office ever.
The girls
Don't-
are awesome. Yeah.
Don't ever let your daughter buy an ear piercing gun online. Okay.
No.
That's a little word of advice
I'll do it,
because mine did. And it was like the Wild West in my house. Like they now have like
And all their friends.
it was bad. So you block that from your Amazon account.
Yeah, I'll do
Um,
I'll do the piercings.
yeah, you're going to take that. Okay. Yoga pants or a blazer?
A blazer.
Okay. Yeah, this is, you know what? Okay, this is going to be a problem. You're going to try and kick me out as your best friend because you are going to want Dr. Ashley Amalfi to be your best friend.
What?
And I understand.
Things you can't.
I completely will understand.
All right.
Okay? And I'll be the third wheel, like trying to be like, hey guys. Okay? Yeah, fine. I get it. Okay.
Can I go on a horseback ride?
All right. She probably has surgeries to go to now.
No, I'm fine. We're good.
Yeah. Okay. All right.
Well, thank you so much for being here. I loved having you on. We can't wait. We'll have to have you back. Like, there's got to be. There's much more subject.
There's
Lauren
so
wants to
much
talk
more
about necks endlessly at this moment, but
I love it.
So, but I mean, the amount of plastic surgery, like facial plastic surgery, that is going on in Hollywood right now is not to be believed.
Yeah.
I mean, Kris Jenner.
Insane.
I mean, Ashley. What happened to Kris Jenner?
What does she do?
She looks amazing. I mean,
amazing.
She had a gorgeous facelift, gorgeous with fat, and she just looks so youthful and not overdone. And honestly, that like reversal of time is really like the new age in facelift. No one's going for that windswept South Florida look anymore. It's really tastefully done, and my partners do a really beautiful job at like these really natural faces. And I think that's what you're seeing. Thankfully, the whole trend in general is not this super fake cartoon look anymore. We're kind of trending towards a much more natural aesthetic overall. Thank God.
Yeah, I was reading that they said it looked like she had like the fillers actually taken out of her face. So like it used to be, I guess, from what I've read up on, that they would add stuff in, but now they're just trying to take stuff away from your face. So like just make your face a little thinner and sleeker.
Yes.
Really, the neck.
Natural.
It's the neck.
Yeah.
It's the neck.
Yeah, the neck looks so good.
But it sounds like overall, plastic surgery is just getting its moment in the sun right now.
It is. Yeah, there's some really cool stuff that is really pretty attractive, and I think that's what we need to see, because we all notice the bad ones, right? That's what we're so used to, is seeing like the terrible boob jobs when they snap celebrities at the beach and
Brandi Glanville.
I know, right? Like
Not
we see
good.
all the
I
bad
know.
stuff. But like I think what you don't realize is how many people actually have good work done, but you don't notice, and that's the point.
Yeah,
I don't want the point.
I don't want you behind someone at Wegmans and being like, "Oh, is that Ashley's patient?" Like, I don't want you to know. I want them to just be, beaming and look amazing and just show up as their best self. And that's
I've always been very scared of recovery.
Oh, here we go. We're now starting a whole other podcast.
That would be next. Very scared of recovery when I have children at home and I have to show up. Like I can't.
Yeah. I mean, it's just planning like anything else. Like if if we really schedule help and like tell you what you can and can't do, it's really just 3 weeks where we need to really kind of organize your life. And we give people all those details about, putting food in the freezer and Instacarting your groceries and getting a cleaning lady and a nanny.
Oh, you're so nice to think of all those things.
She's like the real, I mean, this is like the whole thing.
Yeah.
She's like,
but because she knows.
I get it.
Godmother.
Yeah.
Like she's living that life, you know, like it makes it so much more relatable. And I mean,
I wouldn't like a man doing it.
No, especially the labia, that when you're like, hold up a mirror and let's do this together. I was like, there's not a shot in hell I could do that. I don't even like to take showers.
Yeah.
I mean, I do. You know what I mean.
Yeah, it's different.
Yeah.
It's different.
You're different. You're amazing.
Yes.
Thank you, guys.
Thank you so much.
Grateful you're in our community and a part of our lives and our friendships.
And now we're spreading the awesome of Ashley to everybody else who's not in Rochester.
I love it.
Yep.
Come visit.
So make sure you follow her on Instagram for sure. She has amazing content. It is so great to see everything that she's up to.
Awesome.
And she has really cute kids.
Thank you.
Very cute.
I know.
And they're go.
Oh, yeah.
Oh, yeah.
They do a lot of activities.
Little clones. Yes.
They seem to really like each other. Is
yeah,
that
they're
true?
pretty cool. They really like
That's amazing.
each other. They really do.
That's awesome.
Yeah, they're good people. It's pretty awesome to see them develop into these little humans, but
It's so fun.
And her husband's really cute.
he's a
Yeah.
doll. He's an
Okay,
angel.
so
he's really
He's
cute.
he's the behind the scenes making it all happen so I can live my crazy dreams.
Yes.
What a guy. Yeah. Very nice. That is awesome.
Oh, fantastic. Hey, this has been our longest podcast ever.
I know it
Because
has
it
been.
was so good.
Yeah.
It's
We couldn't
awesome.
stop. Well,
Yeah.
me. Ashley, thank you. I'm going to try now to say goodbye. I'm terrible at goodbyes,
Very
but
hard.
we will
Do it.
see you later.
You can do it.
Thank you
Goodbye,
guys.
Ashley Amalfi. Thank you.
Goodbye, everybody.
Bye. Thank you.
Thank you.